Hello, everyone. Good morning or good afternoon, depending on where you are. Thank you for joining us and welcome to today's webinar, where we are going to be reviewing the findings from a new survey around COVID-19, equity, and domestic violence in California. To begin, I'd like to introduce myself. I'm Richard Vezina, a Senior Program Officer at Blue Shield of California Foundation. In an effort to break the cycle of domestic violence, research findings like the ones we are going to share today are really crucial for our partners and other leaders throughout the state to craft effective policies and programs. Today, we'll hear how the impact of COVID-19, racism, and domestic violence are interconnected, especially for communities of color and LGBT residents. Following that, we'll be joined by two esteemed leaders in the field. First, Serena Khan, CEO of Women's Foundation California, and Jackie Marroquin, Director of Programs for California Partnership to End Domestic Violence. They'll discuss the implications of these findings with me. And finally, we'll have dedicated time with all of our speakers to answer your questions. So to that end, if you would like to ask a question during the course of the presentation, please do so in the Q&A window on your screen. And finally, before we begin, I want to note that today's presentation is being recorded and will be available on the Foundation's website along with some other resources. So with that, I'd like to welcome Debbie Chang, President and CEO of Blue Shield of California Foundation, to set the stage for us. Hi, Debbie.
Thank you, Richard. I am so excited to be here today to talk about this survey. Our mission at Blue Shield of California Foundation is to build lasting and equitable solutions to end domestic violence and to make California the healthiest state. Our experience in domestic violence has led us to prevention as the best strategy to get at the root causes to end domestic violence and promote health equity. Over the last 3 years with our partners and organizations throughout the state, we have worked to invest over $130 million on this prevention strategy. And we are intensifying our efforts to reach the most people we can that are impacted by domestic violence and health inequities, and to reach them with high impact strategies that will change their lives and improve their lives. So we were concerned about the impact of COVID-19 on communities across California. And so this survey really gives voice to their concerns and their experiences, particularly low-income communities of color. And the idea was to get their experiences and views related to health and equity, finances, and a growth in the conditions that lead to domestic violence. Though complex, domestic violence has a lot of different factors that lead to it, including some that we can all relate to. Things like having a safe place to live, earning a living wage, and being able to control that income. We also know that domestic violence is interrelated to deeply rooted social problems such as homelessness and poverty, and that to break the cycle of domestic violence, we need to get at the root causes such as racism and ethnic bias, gender inequities, and income insecurity. So in order to think about expanding programs and policies, we commissioned the research firm Perry Undum to do two things. One is to deepen our understanding of the impact of COVID-19, the racism and domestic violence on Californians themselves, and to get their views and experiences. And secondly, we know that there are gaps in the information about domestic violence. So one of our purposes was to address those gaps. So you might be asking yourself, what's new about this survey? And I want to say to that point that the survey interviewed close to 2,000 Californians, and we intentionally oversampled for Black, Latinx, Asian American, Pacific Islander, and LGBTQ communities So this is a representative sample for California and really represents views directly from Californians themselves. I'm going to let Perry Undum talk about the details, but I wanted to raise 3 compelling trends that we've seen in the survey. Number 1, we're living in different Californias, and that depends on who we are. Secondly, Californians view domestic violence as a public issue, not a private issue. And lastly, Californians support alternatives to dealing with people who have committed domestic violence. So alternatives to jail time, for example, and support assistance to domestic violence survivors and their families. So now let me go through each of these. First, the pandemic is reaching all Californians. We all know that on this call, but it's not that simple. Deep inequities have been exacerbated and exposed. And the survey findings show a huge divide to the point where it's as if we're living in different Californias. The survey data from Californians themselves confirm what we all know, that there's stark differences depending on racial and ethnic factors, to name just one. In addition, with the violence against Asian Americans on the rise, the survey also provides information about how the pandemic is affecting Asian Americans. Now, all of these insights are really important in terms of the prevention measures that we all want to work on to address health equity and end domestic violence. And those measures need to include the needs of all the communities in California. Second, we've long seen that the epidemic of domestic violence is hidden. And one major revelation in the study is a shift in awareness and a realization that domestic violence is not a private issue, it's a public issue. The growing consensus that domestic violence is a public issue is significant because it'll help create momentum for change. To truly end domestic violence, we're going to need to address the systems that create this condition. And that ranges from our housing system to our banking system that controls the private finances, to how we help at-risk families, and to our criminal justice system, which brings me to the third point I wanted to make, which is that the survey data reveals that there's wide support across all groups to address the root causes of domestic violence and health inequities, and to move away from things that haven't been working. So what that means is past solutions such as jail time and relying on law enforcement, there are alternatives to those. They don't get at the root cause. And what we need to do is address the whole family and help that family heal. And that includes supporting the children who have witnessed domestic violence and the abuser. This is the way to break the cycle of domestic violence going forward. In addition to alternatives to jail time, for those who cause domestic violence, Californians strongly supported assistance to domestic violence survivors and their families. Assistance such as childcare, housing, transportation, and food. So together, these findings point to the fact that we need to strengthen the lives of domestic violence survivors, not just address the episodes of violence. With that, I'm going to turn it over to our friends at Perry Undum, and I'll be back for the questions and to make some final comments. I'd like to introduce Naomi Mulligan-Kolb, who is the Managing Director at Perry Undum Research. Welcome, Naomi. She'll outline the methodology and walk us through the results and the data. Take it away, Naomi.
Great, thank you so much, Debbie. And first, I'd just like to thank the foundation for sponsoring and supporting this work. So as Debbie kindly introduced me, I'm the Managing Director and Senior VP here at Perry Undum. I will be walking through the slides today, but I wanted to quickly introduce a couple of my colleagues. We worked on this collaboratively with the foundation, and they're also in the webinar with us, and they'll be participating in the Q&A. So I wanted to quickly introduce Michael Perry, partner here at Perry Undum, and Adriana Bustillo, one of our lead researchers who also worked on this study with us. I have about 20 slides that I'm going to be reviewing from the study in about 20 minutes. So I'm going to go rather quickly. As Richard mentioned at the top, this is being recorded and the slides are going to be made available at the end of the webinar. So anything in here that you want more time with, you'll be able to look through at the end of the meeting today. Let's see. Okay, great. So quickly, Debbie went over some of the methods that we used in the study, but I wanted to touch on just a few more for you all. First, this study was in the field in early 2021 from January 6th to the 22nd. You'll see we, as Debbie mentioned, we had these really substantial oversamples, over 400 AAPI Californians, Black Californians, and Latinx Californians in this survey, as well as almost 300 LGBTQ Californians. This really makes this survey unique. It's not often that we have such large oversamples in our surveys. This survey was also offered in multiple languages, and the margin of sampling error for the total results is 3.2 percentage points. And the survey was among adults in California, 18 and older. Let's see. So I'll dive right into the findings. We wanted to start and kind of meet people where they're at, which is in the midst of a global pandemic. So we wanted to know, how are Californians being affected? And the answer is very greatly. 9 in 10 Californians say that the pandemic and the economic crisis have impacted them and their families. On the right here, we have a chart that kind of describes some of those impacts. At the top here, among parents, almost half have been dealing with distance and virtual learning. 3 in 10 Californians say that their income has gone down since the pandemic began. And 1 in 5 say that either themselves or a family member has had COVID-19, that they're using their savings to pay bills, and that 1 in 5 are also feeling unsafe at work, that they have to go to work even though they feel unsafe there. One other thing that I think is really interesting and shows the widespread impacts that Debbie mentioned is that only 1/3 of Californians in our study report not having any experiences from this list. So, 2/3 are saying, yes, I've experienced at least one of these things since the pandemic began. The next slide. I'm not sure if I'm controlling it. It doesn't seem to be moving. There we go. Thank you. So because we had these really large oversamples, we were able to disaggregate our data and look more deeply at different communities in California. What we found were that Californians of color are really experiencing the greatest impacts during this pandemic. 43% of Black Californians say the pandemic has had a major effect on them and their families. More than 1/3 of Latinx and AAPI Californians say it's had a major effect, as well as 3 in 10 white Californians. This table on the right, I think, is really interesting, and it shows the deep impact on Latinx communities in the state. More than 1/3 of Latinx adults say that their income in their household went down since the pandemic began. Another 3 in 10 say that they or a family member has had the COVID-19 virus. That's really striking when you look across the other demographic groups, that they really stand out here as having direct impact with the virus. And another, more than 1/4 of Latinx adults say they have had to go to their job even though they felt unsafe in that space. I think the last thing that I would like to point out on this table is at the bottom, only 19% of Latinx adults say they haven't had any of these experiences, meaning 81% have had at least one of these experiences that are listed in this table. Again, when you look across the different segments here, the the Latinx community just really seems to stand out. Next slide. Again, we wanted to go beyond just this. The last slide I was on kind of focused a lot on financial impacts of the pandemic, but we wanted to go beyond that and understand the social and emotional and mental health impacts of the pandemic as well. 7 in 10 Californians say that they felt isolated from others since the pandemic started. 58% say they felt trapped in their home. Interestingly, 56% say that they felt closer to their family since the pandemic started. And half, 49%, say that they felt unsafe. We pulled out some of the different groups here on the right around their feelings of being isolated and feeling unsafe. You'll see the LGBTQ adults have been really impacted around feeling isolated and unsafe, as well as more than half of AAPI adults, Latinx adults, and women. And again, just for some context, these questions were asked in the context of just COVID and the impacts in their daily lives. And these findings are not directly related to domestic violence. We can go to the next slide. Here we go. Also, in the context of COVID, we wanted to know how romantic relationships have been impacted. About a third, 3 in 10 Californians say that there has been more tension in their romantic relationships since the pandemic started. In the center here, we wanted to understand what are some of those causes around rising tensions. 63% say anxiety around the future, and 62% say isolation from other family and friends are causing tension in relationships to rise. Another 58% say that just spending more time together and home is causing more tension. And on the right here, we followed up among those who say that tension in their relationships is increasing. 34% of those respondents say that the tension in their relationship is becoming unhealthy. 8% said potentially abusive, and 7% said unsafe. And I do want to take a moment here to recognize in our survey, we provided links to resources. The survey was conducted online, so we made available links to resources for respondents if anybody wanted those. I can go to the next slide. Let's see. Okay, now I think I have control over it. One thing I want to divert away from the romantic partnership and domestic violence for a minute, because we felt like we weren't able to have this conversation around COVID-19 and domestic violence without addressing equity and racism as well. So I'm going to go over some of those findings from the survey as well here. If we can go to the next slide. Great. So most Californians feel that racism has increased in the last few years. 62% say racism has increased. Another 28% say that it's stayed the same. So 90% of Californians say that racism is either increasing or staying the same as it has been in the last few years. Only 10% say that racism has decreased in the last few years. On the right, we pulled out some of the demographic breaks for this question. We've been seeing this in this poll as well as other polls that we've been doing around racial equity. And we see Black respondents really stand apart. 75% of Black Californians say that racism has increased in the last few years. 69% of Latinx adults, 62% of AAPI adults say racism has increased, as well as more than half of white adults as well. We can go to the next slide. We asked this really interesting question of respondents, which is, do you personally feel accepted as an equal and valuable member of society? 1 in 5 Californians said they don't feel accepted as an equal and valuable member of society. Again, this is where Black adults tend to stand apart. Almost half say they don't personally feel accepted and valued in our society, along with about 1 in 5 Latinx and AAPI adults, as well as 17% of white Californians. And we can go to the next slide, thank you. We didn't want to leave the equity and racism discussion without talking about systems as well. 6 in 10 Californians believe that systems in our society are set up to give white people more opportunities than people of color. And Californians of color are most likely to feel this way. Again, 75%, 3/4 of Black adults feel like systems are set up to give white people more opportunities than people of color. 65% of Latinx adults feel this way, as well as 6 in 10 AAPI adults, as well as, again, similarly to the other slide, more than half of white adults as well feel that systems are just set up in a way that give white people more opportunities than other people of color. And we can move on to the next slide. Okay, we're going to return to the discussion around domestic violence. We start out just trying to understand perceptions around domestic violence. 9 in 10 Californians see this as a serious problem. And this chart on the right, I think, is one of the most important findings of the study. 2/3 of Californians consider domestic violence to be a public issue that should be addressed by all of us, rather than a private issue that should stay within just families. So I think this slide tells us that there's a lot of support among the public and a good understanding that this is a serious problem, and it needs a solution and to be addressed by the public, and not just among families themselves or on an individual basis, that this is really an issue that requires a collective action to help fix. Let's see, there we go. Again, sticking with perceptions of domestic violence, this table chart to me is one of the most unexpected findings. We asked Californians if they considered all of these things to be part of the definition of domestic violence. And I was really struck that Californians have a really broad and inclusive understanding of what domestic violence is. It's not surprising that more than 9 in 10 Californians think physical abuse, sexual abuse, emotional abuse, and threats around taking children away, verbal assault, and mental control are all part of this definition of domestic violence. I think what struck me most in seeing these results was actually the bottom half of this chart, that around 3/4 of Californians consider threats around sharing private information like text messages or images on social media, threats to expose immigration status, and financial control to be part of the definition of domestic violence. I think one of the things that was probably the most unexpected finding for me was this last one, that 2/3 of Californians feel that attempts to control a partner's reproductive health, such as using birth control, they consider that to be part of the definition of domestic violence. And I think that's a really sophisticated view. And 2/3 of Californians hold that view. So I think this is a really important slide, and it helps us understand that the public has a pretty broad understanding of what domestic violence can look like. We also included this question asking people to consider, if they had been assaulted by a partner and they were to call the police, if they thought the police would help the situation or not. 2/3 of Californians think yes. If I were assaulted and the police came, that they would help the situation. On the right, however, we wanted to dig a little deeper into this notion and see if there were differences among different demographic groups, and there certainly are. Among Black Californians, only half say they think the police would help the situation. 3 in 10 feel the police would make the situation worse. And 17% say they would not go to the police if they were assaulted. Similarly, among men, generally in the survey, less likely to feel the police would help the situation. 1 in 5 say that they think the police would make the situation worse. Similar proportion feel like if they were assaulted, so if men were assaulted by a partner, that they would not go to the police. 19% say they would not go to the police. Again, this is something that Debbie spoke to in her opening remarks. In our study, we found that 27% of the respondents had experienced abuse from a parent or an adult caregiver or a sibling in childhood, or that they had witnessed domestic violence in their household. We wanted to kind of understand this more and see what that meant for experiences later in life. So in the center here, we have the findings among people who have had those childhood experiences. 64% say they have family or friends who experienced domestic violence. 42% say they know someone who committed abuse against a romantic partner. And 1/3 say they experienced domestic violence themselves. 9% say they committed domestic violence. So when we look at these in combination, 71% of Californians who've had those childhood experiences say yes to at least one of these options that we gave related to personal experiences with domestic violence in adulthood. So again, I think this speaks to the fact that this is not just something that needs to be dealt with on an individual level, but also this is a multi-generational issue as well. Again, building on experiences of Californians who've experienced domestic violence, 56% say that they felt shame during the period that they were experiencing the abuse. 4 in 10 say they felt afraid to tell others about what they were experiencing. And about 1/4 said they had no place else to go and that they didn't have access to money to support themselves if they were to leave. Okay. Of course, we didn't want to leave the poll without discussing some solutions and directions for change. So again, starting with survivors of domestic violence themselves, we wanted to understand how important certain things are to helping them feel safe. The number one thing they say that is helpful in making them feel safe is having a safe place to live. 9 in 10 survivors say that's very important to them. 88% say being financially stable, having personal freedom, and having a city job are all key factors in helping survivors of domestic violence feel safe. We can go to the next slide. As I think, again, Debbie mentioned this, we wanted to explore alternatives to jail for people who cause domestic violence. This got really wide support across respondents in our poll. We provided a brief description of what those alternatives could be. For example, counseling, including substance abuse counseling, supervision by a social worker, or restitution to the person who experienced the violence. 8 in 10 Californians support this idea of alternatives to jail, and the support was pretty wide, even across political party ideology. That's something we don't always see on all issues. 88% of Democrats, 3/4 of independents, and 2/3 of Republicans support this idea. And the last thing I'm going to cover in terms of solutions and outcomes again, we asked Californians, do they support any of these ideas to help survivors of domestic violence? And the support was really strong. Over 9 in 10 Californians support childcare assistance, food and housing assistance, as well as transportation assistance for those who are experiencing domestic violence. And 8 in 10 support things like paid leave from work, as well as cash assistance. We added in this slide because we felt like we have such rich data, and there's a lot of interest around what AAPI communities are facing right now. And so I wanted to just bring these forward. Again, this is all going to be available afterwards, but a few things to highlight on here. Again, more than half of AAPI adults right now report feeling unsafe during the pandemic. Again, that's a more general feeling. It's not related to domestic violence, but just the general feeling since the pandemic started. And we also had another question about whether Californians feel like it's a good time or a bad time to be any different segment of the population. We had a very long, expansive list, and that included an AAPI man and AAPI women. And more than half of AAPI adults feel like it's a bad time to be an Asian woman or an Asian man in America right now. Just a couple other highlights before I pass things back. 90% of AAPI adults feel that racism has either increased or stayed the same in recent years. 1 in 5 feel like they do not personally feel accepted as an equal and valuable member of society. And then just to touch back to the domestic violence, even among AAPI communities, 90% say domestic violence is a serious problem in society right now, and something that we kind of just all need to be aware of and addressing. I think that with that, I'm going to pass things back over to Richard with the foundation.
Thank you, Naomi. We're really grateful to you and the Periendum team for all of this work. It's really incredible. And I want to remind everyone that these slides, the recording, and additional materials are going to be available on the Blue Shield of California Foundation's website. And I believe links will be sent out after this meeting to anyone who's registered for the webinar. Now I want to invite our panelists to join me in the conversation to better understand the implications of these findings. So I introduced them at the top. I get the pleasure of welcoming Serena Khan and Jackie Matakin to speak with us. And I also want to remind all of you to keep adding questions to the Q&A during this conversation. I've seen some come in during the presentation. After the three of us have a chance to chat, we'll be inviting Debbie and Naomi back, and we'll address some of those. So with that, let's start our discussion. And rather than beginning with introductory comments, I thought we would just start with an observation about the survey. So one of the things that this survey shows really clearly is the disproportionate impact that COVID-19 is having on communities of color and women, not to mention LGBTQ communities in California. So I was wondering if you could start by sharing how your organizations are working right now to address these challenges. And maybe Serena, we'll start with you, and then Jackie, you can follow up.
Sure, thanks, Richard. And first of all, just thank you so much for commissioning this research and for inviting Jackie and me on to comment on the survey results. At Women's Foundation California, we have a three-pronged strategy, which is to invest in, train, and connect community leaders to advance racial, economic, and gender justice. And so just very broadly, I will say that about over 90%, almost 90% of our grant making goes to Black, Indigenous, people of color communities. Almost 90% of the fellows in our Women's Policy Institute are people of color, and those numbers are similar in our staff leadership and our board leadership. So we're very invested in women of color, both cisgender and transgender and gender non-binary folks. And so early on in the pandemic, we, all, I think, began to see that domestic violence rates were spiking in every one of California's 58 counties. And so we were grateful to have this long-standing partnership with Blue Shield California Foundation. And because we very quickly got grants out to our core grant partners and started our Relief and Resilience Fund, because we recognized that in order for them to continue doing their work with the shelter-in-place orders, that they may not have laptops or Zoom memberships. And so we wanted to make sure that they were organizations were resourced. And that was the genesis for our Relief and Resilience Fund, which we partnered with Blue Shield of California Foundation to, again, very quickly, within a matter of weeks, get funding out to every domestic violence shelter organization in the state. And, the California Coalition to End Domestic Violence was an incredible strategic partner in that, just in terms of getting us the logistical information of people's contact information, but also strategizing with us about the narrative shift that also needed to happen, because early in the pandemic, we were seeing that everyone is safer at home. And what we had to say to the governor's office is that you really need to nuance that language, because not everyone is safer at home. And that led the governor's office to make some big investments in domestic violence and to join us in our Relief and Resilience Fund to then grant hopefully up to $50 million out the door to end gender-based violence, as well as to think about what does a feminist future for California look like. And then finally, I'll just say that we, again, in partnership with Blue Shield of California Foundation and Fondation Chanel, and I believe the Hilton Foundation, we're supporting 7 organizations that are aiming to end domestic violence in a cohort that is called the Home Cohort, which is Housing Opportunities Mean Everything, working to center housing and economic security for survivors of domestic violence. And as we saw in the survey results, feeling safe at home and having shelter is so important. So one of its primary goals is to educate and motivate property owners to rent to survivors and to protect tenants that are survivors. And then finally, I will say one of the most important things that I think we're doing is really trying to shift culture. That if people think this is a public issue, we have an opportunity to really shift the way that people think about it, to say that this is unacceptable. And so we have our Culture Change Fund that we're working on, again, in partnership with Blue Shield California Foundation. And I think with the survey results that there's a real opportunity to deepen that work. So I'll pause there and let Jackie respond.
Yeah, and thank you again. Thank you to the foundation, and thank you for all of your work in really highlighting things that we know survivors are needing and wanting, and families and communities are really needing and wanting. So I'm just so proud to be here and proud to represent the partnership here too. I think that the data that does show varied experiences, that means that it requires a varied approach to responses as well. And so that's one of the things that I think we've been able to do, not just with the partnership, but also in the field, that really thinking about both two different things. One is intervention, which is a very healthy, good, infrastructure that the domestic violence field has developed in the last 40 years that has no doubt saved lives. And that system is a very, while there's still a lot of work that is needed in that intervention immediately after a crisis, there is also a need to look at prevention. And so both of those things are needed together. And I think that's part of the varied approaches and the varied experiences that are highlighted in this particular study, right? That folks are really thinking beyond physical safety. Physical safety is still really important and necessary. And there are other types of safety that families and communities really need. And so I think about my own family, right? I'm not in an abusive relationship, and I have a steady job, and I have, I've been able to continue working. And this is still a really hard time for me and my family. I cannot even begin to imagine what it is like for families who are also experiencing abusive behaviors. and not only abusive behaviors in their home, but outside of their home as well. And so because of that, these prevention efforts are really necessary to mitigate some of the pressures that families are experiencing, that there's a collective experience of trauma right now, collective experience of like this economic downturn. And there's also this collective experience and this need to address those issues prior to a crisis actually occurring. And so the idea really is, I think the field has done a really good job to pivot. Like Serena says, we partnered with Cal OES and with the foundation and with the Women's Foundation to push money out into the field, because there were innovations that were already occurring. We were already thinking about them. COVID just really forced us, like really pushed that innovation forward to a place where we're now saying like remote services are just a thing. This is our new normal. So from moving forward, I think we are looking at a new normal. What is a new normal? What do services look like in terms of a new normal? What does prevention look like in terms of a new normal? What do intervention services look as a new normal for not only service providers, but for families and communities? Eventually, all of these things really serve to keep us all safer and, in a better place.
Well, let's look more closely at that. I want to ask the two of you one more question and then invite our colleagues back on for some Q&A from the folks attending this webinar. So we just saw in the survey, domestic violence survivors naming some very practical and achievable things that they need in order to feel safe. And we saw that there's really broad public support among Californians in general, right, around a range of solutions outside of criminal justice systems and criminal justice responses. I'm wondering if the two of you, we have about 2 minutes before I want to transition back, and maybe Jackie, will start with you, and Serena, you can wrap us up. I'm wondering if the two of you could talk about what's needed then. We have this broad support, we have survivors naming what they want and need. What's needed to move some of those solutions forward?
Yeah, the most important thing is the ability to provide flexible services, flexibility in everything. Because as you saw here, there is a varied need, therefore varied responses are necessary. And there's also a range of responses. So the one size fits all model for anything really is no longer, going to be helpful for the entire community. So that's where I will leave it.
Yeah, I will add that just to take an optimistic view is that we have a lot of amazing resources in California in terms of coalitions, like the Coalition to End Domestic Violence, the Stronger California Coalition, this home cohort. Our Women's Policy Institute has trained almost 600 community leaders, each of whom are connected to thousands of people, which means if you do some simple math, we can activate millions of people in California for progressive policy change, including ending domestic violence, but also to connect those advocates to culture change, strategists, artists, because I think that, if we have a culture of violence, where is that coming from? It's coming from the images that people see, the movies that we're streaming, the music that we're listening to. And so part of that is related to the fact that 96% of all directors in Hollywood are white men. And so we see a lot of violence coming out of that. And so we have an opportunity, I think, through the various, infrastructure organizations and incredible movement leadership in California, that we can do a lot, and we just have to look at the strategies that we're using. So I'm excited to use this data to reinforce some of the strategies that are already in play, and I think we just need to double down on those, and we can really create a lot of momentum.
Thank you both for those insights. I think they're really informative. I'm going to welcome back Debbie Chang and Naomi Kolb-Mulligan, and we're going to answer some questions from folks who have dropped them into the Q&A of the webinar. I'm going to start with a question, and actually, Serena, part of your last remarks, you talked about, activating networks of folks in order to advance progressive policies. So there's a question that comes in from Julia Weber from the Giffords Law Center to Prevent Gun Violence. are we planning on presenting this important research to California policymakers? And maybe I would expand upon that question by saying, what are the ways that we can make sure that policymakers have this information and act on it? So Debbie, maybe I'll start with you and thinking about what the foundation's doing since we commissioned this, and then I'll throw it open to Serena and Jackie as well.
Thank you. There's a lot of things that we can do, I think, to promote the data. And the first step is awareness. And so it's really important for us to distribute this. We're doing that today through this webinar and through our social media networks. And I think there's even more we can be doing in terms of additional briefings. So I'm really looking forward to hearing from my colleagues on this panel and others about other ways that we can get this information out. We're also doing press briefings, those kinds of things as well. There's a range of things. I'd like to hear from them on what you think are the most important ways. We do have the honor of working with so many great partners, including Serena and Jackie and others. And so activating those networks, I think, will be really important as well.
Yeah,
Serena, Jackie?
I'll jump in. Debbie, I think that's absolutely right. And I'm so thrilled to hear that, you're taking such a multi-pronged approach about getting this information out. I think in response to the question around policymakers, I think that's really important too, in terms of just educational briefings for either the Women's Caucus or other, other caucuses in the Capitol. For the governor's office, even. I think that, to offer these briefings to policymakers will be important. And I think that the most effective way to get the information out is to really speak to people who are being impacted by these issues and to see what their response would be. Our founding principle at the Women's Foundation is that people who are closest to the problems are also closest to the solutions. And so, when you take the data and then combine it with the stories of people's lives, that is going to help people to really emotionally connect. Because probably, as the data has showed, we have all experienced in some ways or observed or been close to domestic violence. And so I think there's a lot of opportunities in terms of sharing this data and combining it with people's stories. And maybe there's a sort of a visual approach to it as well.
Yeah. I'm going to, go ahead, Jackie.
I was just going to say the validation that this report actually gives to lived experiences of folks on the ground is immeasurable. Like, that is just an amazing thing for survivors and for advocates to be able to say, oh, this data actually resonates with us and it's true for us. That's huge.
Yeah.
I just wanted to add one more thought, if I could, Richard, that I think is important because we're talking about policy solutions. And our panelists talked about this preceding this Q&A, and that is that there are solutions. For example, we know that domestic violence housing first is an effective program. It's now in 65, sites, and we need to spread that across our state. And so, and by the way, to the point Serena is making, in our experience, it was talking to domestic violence survivors where the idea of, focusing on housing, that's the number, and the survey showed that too. Naomi shared that. It's one of the, I think 90% said that was one of the keys. And so listening to the survivors and people, and then building our solutions based on that is what we need to do. And we need to spread what we already know works. So domestic violence housing first works. Go ahead, Richard, sorry.
No worries, thank you. So I have another question that came in from Lisa Tadlock of the Public Health Institute. And Naomi, this is a data question. And then, Serena and Jackie, I'm curious to get your take more broadly on the question underneath it. And so the question is if we were able to make comparisons between urban and rural areas. And I know we did collect some geographic information. And so Naomi, maybe you can say a little bit more about that. And then Jackie or Serena, maybe you could just talk about the differential experience of rural versus urban in California. Naomi, why don't you start?
Yeah. Absolutely. Thanks for the question. We did. So I think, again, the rural numbers, I'm not sure that we had enough to report out entirely, but I do know that we did some regional breakouts, and the regions that have, a lower population density and are typically have more rural communities in them, we did see differences compared to the more urban regions. For example, the experiences with domestic violence actually were slightly higher in the rural communities than in some of the more suburban and urban regions. I know that, and then also in terms of the COVID-19 impact, it was somewhat reversed, that folks in the more urban centers were feeling more and broader impacts from the pandemic than those in rural communities. So I think those were two places where we saw differences between them on those two separate issues, the pandemic and then experiences with domestic violence as well. So that's just a couple points here on that, but happy to hear Jackie and Serena if you have other thoughts on those.
Yeah, I'll just add that there's a continuing awareness, I think, of the differences and the similarities in terms of how to provide services, how to provide prevention and intervention services in rural areas. I think the biggest divide here is simply access, and just the sheer number of support systems that are in urban areas that just simply don't exist in rural areas. I hear and have heard from, folks who say, like, literally it's a 1 day trip to get to a courthouse. You have to, or, if weather, can impact someone's ability to be able to, like, literally get out of their community and go somewhere else. And so I think those are the places where the rural areas really have to innovate even more than the urban areas in order to be able to fulfill the needs in their communities, which are very different and actually cost more money in terms of being able to provide support and services to folks in rural areas. And also, the fact that there's less number of people does not mean that it costs less to serve those people either. So I think that's one of the awareness pieces that we've been hearing about a lot.
Yeah, I'll just add, this is making me think about the importance of the intersection of the issues. And it becomes, incredibly pronounced in rural areas. So I've actually been in northern Sonoma County in a rural community for the last year. And one of the bigger issues when shelter in place happened was broadband access. So if kids are having to learn at home, and so in a low income community near us here, a group of people rallied together to make sure that that community could quickly access broadband internet, because those kids in those homes needed to be having education and distance learning, which you can't do right now without internet access. And so I bring that up because, the more pressures you have in a home, then, the greater risk there is for violence. And so if we can address some of the issues around economic security, food justice, in rural communities, what Jackie was saying, like a day-long trip to go to the courthouse, there's not even really much access to public transportation. So how are you going to get there? Who's going to take you there? So all of these issues around transportation, food, economic security. I'm glad to see the connection about alternatives to jail. That's a big development in in the DV field. So we know what the problems are, and we have access to a lot of the solutions.
Thank you. So I'm watching the time. I want to offer up one last question that came in because I think it's important. And then I know we're approaching the end of the hour. So let's tackle this. And then Debbie, I know you have some closing remarks for us. So the question that came in is, how do we address these multiple crises with a racial justice and racial equity lens? Not a small question. We could use an hour all on itself to talk about this. I'm wondering if you have any insights, though, really from anyone in the group about how to answer that question as we close out this webinar.
I'll start by saying we have to center women of color, especially people of color. Again, going back to this principle that people who are closest to the problems are closest to the solutions. And that's not to say that, domestic violence is endemic. It affects all communities. And I think that it's really important for us, given the multiple layers and barriers that communities of color face, that we have to start there in order for then the benefits to be experienced by all.
Yeah, I think at this point in time, we cannot do this work without a racial justice lens. I mean, you just have to. It's not something that is optional anymore. It is something that we are building in and baking into everything that we do. And it is necessary and meaningful, and it will save lives.
And I just want to underscore.
Go ahead, Debbie.
I just want to underscore again that it's so important to include the lived experience in the development of solutions. And that's something that's so essential. And that means that we need to look at including everyone into this process when we think about not just developing the solutions, but also advocating for them.
Yeah. And I'll add that part of our motivation in doing this study was to bring a racial equity lens to this question, right? We knew we had to disaggregate the data in very particular ways. We knew we had to oversample to make sure there was representation. We knew we had to construct questions in particular ways that would be inclusive. And if you don't ask the question, you don't have the information. So with that, Debbie Cheng, you have some closing remarks for us. I want to thank Serena, Jackie, and Naomi, and thank everyone who has been listening along and offering questions as well. Debbie, why don't you take us out?
Great, thank you. This has been a really exciting panel. As we look to what's next, the foundation is already starting to share this information. We've shared it with obviously the panelists on this call, but also we're sharing with others to help inform the programs and the policies that we advocate for. And I think it's really exciting that the views from Californians are so consistent with what's already going on. Both Serena and Jackie talked about how they're approaching the work. I've talked about how the foundation's approaching the work. We also know that the views from Californians are consistent with recommendations from the Little Hoover Commission that is focused on prevention and early intervention. And these views are also consistent with the work of the Futures Without Violence and focusing on alternative solutions to addressing the issues of domestic violence, like restorative justice and providing supports that are needed for domestic violence survivors and their families. And I also think we are living in a time where there's renewed attention to this issue, and that and it's at the state level, of course, and the local level, and also at the federal level. So it's a good time for all of us to work together to develop a set of solutions that then we can spread and scale, throughout California. Our goal at the foundation is to end domestic violence. And we know that's not going to happen overnight. It's going to take a concerted effort working with all of you on this call and with our partners to make that happen. And so we're really excited for you to look at this information. There's a lot of great stuff on the website. Give us your insights. We want to engage with you. If there's one thing I know, it's this: to solve complex problems like domestic violence and promote health equity, we need to work together to do so. So with that, I want to close out and thank everyone for joining. I really want to thank the team at the foundation for their leadership in this, Richard Vesna, and also Lucia Coral Pena, who's been, as everyone knows, a longstanding advocate and expert on domestic violence. And also thank Perry Undum and the team there for the wonderful work they've done. And I want to especially thank our partners who helped to inform the survey design and interpretation of the data. And they include, of course, California Partnership to End Domestic Violence, Futures Without Violence, the LA County Office of Domestic Violence Council, PolicyLink, and Women's Foundation California. And I also want to remind everybody that a recording of the webinar and slides and other information are available on the Blue Shield California website. We're going to send you an email with the details about how to access those materials. And I just want to thank everyone again and just say again how much we look forward to working with all of you on our shared goals of ending domestic violence and promoting health equity in this country. Thank you.